Intravenous therapy is one of the most important and delicate skills in nursing care. And when we talk about the role of the licensed practical nurse or LPN, in the United States, it's essential to understand what they can and cannot do according to the practice regulation in each state. LPNs play a key role within the healthcare team. They provide direct patient care, monitor vital signs, administer medications, and assist registered nurses in overall patient management. However, when it comes to intravenous IV therapy, their specific responsibilities depends on the scope of practice defined by each state's Nurse Practice Act and the State Board of Nursing regulations. Now, let's see what LPNs can do in most states. LPNs are allowed to perform IV therapy procedures as long as they have complete formal education and obtain an IV certification. This usually includes preparing and maintaining peripheral IV lines, administering IV solutions without medications such as a normal sign or D5W, monitoring the insertion site and identifying complications like phlebitis, infiltration, or extravasation, removing peripheral IV catheters, and finally, documenting IV therapy and reporting any changes to the RN or healthcare provider. In some states, after receiving or having an additional IV training, LPNs may also administer certain medications by IV, manage infusion pumps and following protocols, but only under the supervision of a registered nurse or a healthcare provider. There are a few states with more autonomy. For example, states like Florida, Texas, and Ohio. They allow IV certified LPNs to administer antibiotics, vitamins, before line flushing, and manage infusion pumps, always following specific protocols and facility policies. Now let's talk about the limitations for the LPNs practices. LPNs are not permitted to perform complex IV procedures or administer high-risk IV medications unless the state law specifically authorizes it. Generally, LPNs cannot administer medications through central lines such as PIC or CBC lines unless they hold advanced certifications. Initiate or manage blood transfusions, administer chemotherapy or vasoactive medications like, for example, dopamine, nitroglycerin, or insulin infusions. Insert central lines or PICs, and finally, they cannot adjust continuous IV infusions rates without a provider's order. But what does it mean supervision or responsibility in this scenario? In all cases, LPNs must work under the supervision of a registered nurse or a licensed provider, especially when they performing IV therapy. This does not mean they lack autonomy. It ensures patient safety and legal compliance. The scope of practice also requires that LPNs immediately report any adverse reactions or abnormalities at the infusion site. To perform IV therapy, the LPN must complete a set of approved IV therapy course. These courses usually cover anatomy and physiology of the venous system, site selection and catheter insertion, types of IV solutions and drug compatibility, infection control and aseptic technique, and recognition and management of the IV complications. After successfully finishing the program, the nurse receives an IV therapy certification, which becomes part of the LPN license record. Here's a key point. Not all states allow the same level of practice. For example, in California, LPNs are called LVNs, licensed vocational nurses, and their IV privileges are more limited. In New York, most IV procedures require direct supervision. And finally, in Texas and Florida, LPNs often have greater independence, especially in home health or outpatient settings. That's why it's essential to always review your state's Nurse Practice Act and verify your employer's IV policies. Intravenous therapy is not just a technical skill. It's a professional responsibility that requires precision, knowledge, and ethical judgment. Every practical nurse who masters IV therapy contributes to patient safety and the overall quality of care. So, if you're starting to become an LPN or already working in the field, keep learning, stay current with your state guidelines, and always practice safety and confidently. If you found this information helpful, follow us on our digital platforms on Instagram, YouTube, Facebook, TikTok as Enfermeras Onusa or En Class with Enfermeras Onusa. Share this video and invite your nurses to join our growing community. Let's keep using this space as a powerful study tool and professional support network. Remember, together we learn more and care better.